for aching killers. Health stakeholders are calling for the adoption of innovative and emerging technologies such as gene drive to change the focus on the war on malaria from just controlling its spread to actual elimination. The African Institute for Development Policy and other stakeholders have urged the government to allocate adequate resources to boost initiatives by institutions in fighting malaria.
According to 2020 World Health Organization report, 229 million people were infected with malaria in 87 malaria endemic countries. The African region recorded an estimated 215 million cases in 2019, which accounted for 94% of cases, including Nigeria at 27%, Democratic Republic of Congo at 12%, Uganda at 5%, Mozambique with 4%, and Niger 3% accounted for about 51% of all cases globally. Although milestones have been made, the persisting high rates of illnesses and deaths have called for concerted efforts towards malaria elimination. Health stakeholders highlighted the current strategies for malaria control in Africa focus on vector control and drug therapy, calling for adoption of innovative and emerging technologies in the war against malaria in the country.
Emerging technologies have a role to play in changing the story of health in Africa. Like malaria elimination can actually be a possibility if we look at some newer ways of eliminating malaria.
The group stated that mosquitoes and the malaria parasite are increasingly becoming resistant to current methods, a situation which has reduced the efficacy of existing tools, adding that emerging transformational technologies such as genetically modified mosquitoes may be part of an integrated approach to advance from controlling the spread of malaria to eliminating it.
If this technology is successful, using the gene drive to control mosquitoes, it means that Africa will live without malaria. So today, we've got so many people dying from malaria in the world, like 400,000 people dying. 90% of those are from Africa. So really, if 250,000 people don't die from Africa, then our human resource is remaining where it's supposed to be.
The stakeholders now challenging the government to allocate adequate resources to boost initiatives such as research by institutions in fighting malaria, as well as improve health in the country.
If the government is committed, even in driving and reducing taxes and everything, possibly it might become cheaper, and therefore what we require is a higher allocation of funding to researchers to be able to drive the research. The government has a bigger role to play on this, because if you look at the amount of research funding that the government is giving, it's too little to do any impact.